Let me ask you a question, Chris. Would you be surprised if I told you that the Navy has credited you with over 160 kills? Do you ever think that you might have seen things or done some things over there that you wish you hadn't?
Oh, that's not me, no.
What's not you?
I don't tell you enough. I'm so proud of you. You're such a great father.
So you're not worried about what might happen?
I'm willing to meet my creator and answer for every shot that I took.
I'll pick it up. Drop it.
So what, are you in Germany or where?
I'm stateside.
You're home? What are you doing?
I guess I just needed a minute.
The thing that haunts me are all the guys that I couldn't save.
Hey! Tend to my daughter, please, right now! I'm ready.
Oh my God! I'm ready to come home.
Chris Kyle was born on April 8, 1974, to Wayne and Debbie Kyle. His brother Jeff Kyle also served in the Iraq-Afghanistan War as a Marine. Chris was 30 years old when he enlisted in BUDS training, which is short for Basic Underwater Demolition or SEALs training. He was 38 years old when he was murdered by a Marine who was also suffering from PTSD. Chris served 4 tours in Iraq-Afghanistan War. He is a male. He is Caucasian. He is married to Taya Studebaker, in which he met when he was training to be a SEAL. They have 2 children together, a boy and a girl. Chris grew up in Odessa, Texas. The DSM-5 criteria for PTSD includes 8 principles. The first one being the person was exposed to death, threatened death, actual or threatened serious injury, or actual or threatened sexual violence. With over 160 accredited kills, Chris Kyle witnessed many deaths. The second principle is the traumatic event is persistently re-experienced. Chris Kyle served 4 tours in Iraq and constantly had to relive his trauma. The third is avoidance of trauma-related stimuli after the trauma. Chris Kyle didn't return to war after his 4th tour, following the longest shot in American history at over a mile long and eliminating the other extremely experienced sniper. The fourth principle is negative thoughts or feelings that began or worsened after the trauma. He was not aware of his achievements while serving. He also did not like talking about his experiences to family, his psychiatrist, or fellow veterans. The fifth is trauma-related arousal and reactivity that began or worsened after the trauma. Many scenes in the movie display his increased aggression toward everyday civilians following his tours. For example, when driving down the freeway, he often feels like he is being followed, and he reacts accordingly by increasing his speed and driving erratically. Number 6 is the symptoms last for more than 1 month. Chris Kyle's symptoms lasted for the rest of his life. The 7th principle is symptoms create distress or functional impairment. Chris often zones out as he is recalling events or hallucinating about wartime. For example, his wife forces him to see a psychiatrist after an incident at home, which we will see later on. The final principle is symptoms are not due to medication, substance use, or other illness. Chris Kyle did not take medications and did not abuse any drugs or other substances.
Signs and symptoms of PTSD. Observations. Appearance, weight 230 pounds, height 6'2", hair brown, 3 visible tattoos. Speech, southern accent, deep voice, assertive. Maintains eye contact. Motor activity normal. Affect, full, tense. Mood, anxious. Cognition AO ×3. No memory impairment, attention normal but at times distracted from reality due to auditory hallucinations. Signs and symptoms continued. Perception, auditory hallucinations and derealization, thoughts, no suicidal ideation, homicidal towards anyone who possesses a threat/harm toward himself, his family, or fellow American soldiers, delusions, paranoid, behavior, cooperative, paranoid, and aggressive, insight, he's in denial of his disorder, judgment, good. Relevant client history. Family structure. Father is head of the house, extremely structured and protective of family members. He was taught to hunt and shoot by the father and inherited protective personality from the father. Education, high school. Work, professional Bronco rider and then stopped to join Navy SEALs from 1999 to 2009. Social supports, he was very close with his brother growing up. However, his wife did not support his choice to be in the military, for he had children to take care of on tour. Chris has a very close alliance with his Navy SEAL teammates as well. Economic factors, low pay while being in the military. Risk factors, there was constant potential for death. He had a huge desire to protect every U.S. soldier and kill the enemy. Client strengths, extremely skilled in combat, especially using the sniper rifle. Superior judgment and insight. Great family man and friend. Leader and looked up to by all branches of the military for his courageous acts, thus earning him multiple medals. And he also goes to the psychiatrist but is not prescribed any medication.
Our primary nursing diagnosis is risk for other directed violence, related to past history of aggressive behavior. We chose this as our primary nursing diagnosis because patient safety always comes first. The subjective data were quotes taken from both the movie and Chris Kyle's autobiography. The subjective data was, "I do it to protect you. I have to serve my country." The objective data was, the patient attempts to hit dog with belt after the dog playfully knocks a boy down to the ground. One short-term goal was that the patient should identify consequences of impulse actions to self or others within 2 to 3 days. A long-term goal was the patient will be free of violent behavior within 3 months. One nursing intervention is to assess causes of aggression, social versus biological. The scientific rationale is knowing the client, having experience with similar clients, paying attention and planning interventions are expert practices used by clinicians to predict and respond to aggressive behavior effectively. A non-confrontational approach is most effective. Our second nursing diagnosis is post-trauma syndrome related to auditory hallucinations and derealization, as evidenced by unnecessary aggression outside war zone. The subjective data was, war puts lightning in your bones and makes it hard for you to hold on to anything. The objective data was, the BP was 170/110, and the patient has auditory hallucinations when he hears gunshots and screaming while staring at a blank TV. One short-term goal was to acknowledge the traumatic event and begin to work with the trauma by talking about the experience and expressing feelings of fear, anger, anxiety, guilt, and helplessness within 2 weeks. The long-term goal would be to return one daily routine to pre-trauma level of functioning. This would be considered a lifetime goal. The nursing intervention would be to help the individual try to comprehend the trauma if possible. And the scientific rationale is a stronger sense of coherence, as the ability to perceive a stressor as comprehensible, manageable, and meaningful renders the client somewhat resilient to symptoms of PTSD. Our third nursing diagnosis was grieving and complicated grieving, related to friends and fellow Americans dying in battle, as evidenced by somber moods. Our subjective data was, what haunts me more is thinking about the guys that I didn't save. Our objective data was, change in mood when hearing of the death of a soldier. Our short-term goal is the patient should be able to identify signs and symptoms of his own grief within 5 days. Our long-term goal is the patient should continually seek counseling from a psychiatrist in support of his family with the hope of managing his grief. One nursing intervention is to provide time and space for the person to tell their story. The scientific rationale is the client suffering from Parkinson's disease uses narrative theory to help the client develop new coping strategies and a new sense of identity as a spiritual, contingent self as the disease eroded the client's physical self and former life. These are some examples from the movie of his nursing diagnoses.
And I'm going outside.
Look at you. It's your face again, babe. Looks good.
Oh, good.
Looks different. So the game's is Saturday. You know, he's the tallest kid on the team. Doctor said he could be 6'4". Isn't that insane? I can't wait for you to see him play. I go so crazy, though, when the other kids jump on him. Like, I need you there as, like, a leveler, you know? Like, hey, maybe you could even coach, you know? Kenna's gonna lose that tooth, and I'm so worried she's gonna swallow it, like in her sleep or something. And she said she'd let you pull it, but only you. Would you do that?
That's my daughter over there. I think she's crying. Can you help tend to her, please? Excuse me. Hey. Hey, where are you going? Hey. Hey, can you tend to my daughter, please? Hey! Hey! Tend to my daughter, please, right now!
Hey, Mark. Looks like someone left in a hurry, huh?
Contact window! Stand down! Contact window! Contact window! Come on, Mark. Let's go, buddy. I got you, man. I got you. Look at me. Look at me. I got you. Mark's gone, bro. I got one Sarah down. I need a cat's back immediately. We gotta fucking move him.
Glory is something some men chase and others find themselves stumbling upon, not expecting to find them. Either way, it is a noble gesture that one.
This is a concept map for Chris Kyle and all his diagnoses that relate to his PTSD. So our primary diagnosis is risk for other-directed violence, since safety is always a priority and is related to past history of aggressive behavior.
Chris Kyle's first confirmed kills were a child around 10 years old and a woman. This was an ethical issue for him because he had children of his own and he had to decide between the lives of his men and the lives of this child and woman. Chris never had a problem killing another man because he hated anyone who tried to hurt Americans. A quote from him was, "You ever think about what happens when there's a person at the end of that gun? I just hope I can do my job."
Hold on, I got a woman and a kid 200 yards out, moving towards the convoy. Her arms aren't swinging, she's carrying something. Yeah, she's got a grenade, she's got an RKG Russian grenade. She's saying to the kid. You said woman and a kid. You got eyes on this? Can you confirm?
Negative. You know the ROV. Your call.
Man, they fry you if you're wrong. They send your ass to Leavenworth.